Ultimate Guide Module 6, Relationship between Patient Access and Patient Accounting. Learning Objectives. Upon completion of this module, you should be able to list some of the demographic information needed to process an average patient bill, list some of the benefits an effective pre-admission process offers patients and the billing process, list the signatures that are required to complete an admission, describe patient access's impact on the billing process, describe the claims adjudication process. Module 6 Self-Assessment. Question number 1. Which of the following is a signature that is required to complete an admitting encounter for all patients? Option A, Important Message for Medicare. Option B, Consent for Treatment. Option C, Payment Agreement. Option D, Advanced Beneficiary Notice. Question number 2. Claims adjudication does not include Option A, Determination of benefit levels and coverage. Option B, Coordination of benefits. Option C, Application of payment. Option D, Generation of appropriate explanation of benefits. Question number 3. Which of the following is an example of front-end employees? A, registrar. B, receptionist. C, nurse. D, physician. Question number 4. Which of the following is a critical encounter data element? Option A, patient name and address. Option B, social security number. Option C, policy number. Option D, subscriber information. Option E, patient work number. Or option F, all of the above. Question number 5. When is the best time to obtain critical encounter data? Option A, prior to the patient encounter. Option B, on the day of service. Option C, after services have been rendered. Question number 6. An 837 transaction is used to bill what type of claim? Option A, institutional. Option B, professional. Option C, electronic. Option D, paper. Question number 7. What is a 270 transaction? Option A, the amount of money hospitals receive. Option B, inquiry to payer about eligibility. Option C, response of inquiry. Option D, request for authorization. Patient access and patient accounting. Patient access services and patient accounting. Patient access services and patient accounting personnel play a critical role in the efficient accounting process. Personnel in both departments must recognize providing efficient, effective caring service will give our hospitals a competitive edge. The cost of dissatisfied customers can be summarized in the terms of hard and soft cost. The hard cost is the loss of future revenue. The soft cost, which is less easily identified and quantified, is the customer's negative word-of-mouth advertising. This may influence others not to use our hospitals in the future because of their patient experience. Patient flow. Patient access services personnel generally understand that efficient patient flow is a critical component of caring customer service. Patient account flow. It is equally critical for a patient access personnel to understand that patient account flow is also a critical component of caring customer service. The start of a claim starts off with patient registration, insurance eligibility, patient appointment, then moves to claim submission, where charge entry, medical quoting, and timely claim submission. Then goes to claims management, which is payment posting, medical coding services, denial management, and appeals. And then travels to accounts receivable management, AR follow-up, patient collections, and patient statements. And after that is analytics, payment postings, medical coding services, denials management, and appeals. And then the process starts over again. Patient account flow. The patient first contact is usually with a scheduling or registration employee and not necessarily with a clinician. These front-end employees must understand their impact on the account flow process most effectively extends to the caring service to the internal and external customers. An understanding of the flow of a patient account is critical to understanding how patient access services impacts patient accounting. A patient account usually created by the front-end process or patient access staff, actively such scheduling, pre-registration, outpatient registration, or inpatient admission. So the patient account can start with patient scheduling, pre-registration admission, then flow to registration, admission verification. Once created, additional processing may occur. Inpatient accounts may be reviewed to verify the appropriateness of the inpatient stay. Charges and medical codes must be applied to all accounts by other departments, including clinical departments and health information management medical records. At the end of the process, the account should pass through patient accounting as a clean bill that can be sent electronically or manually to the payer. It is important to note that the entire process should take no longer than 4 days to avoid impacting hospital cash flow. So after the patient has maintained their stay, it'll travel through coding, then billing and collections, and then go to the account follow-up process, and then the patient should receive their bill. Managing expectations is good customer service. For scheduled services, it is appropriate to perform financial clearance procedures. Instructing patients about billing procedures at the appropriate time will give patients a better understanding of their financial responsibilities. When possible, all patients should be provided with estimates and/or connections to the financial counselors. After care is completed, billing and payment issues will be handled by the patient accounting department. At our fictitious hospital, HRO Model Medical Center, we expect to extend the same care the patient received during access and treatment to be provided during the billing process. Patient accounting departments may also be referred to as patient financial services or the billing department. Patient accounting extends caring service by billing statements that are easy to understand, extending business hours for inquiries and complaints to the times that are convenient to our customers, online bill payment, mobile apps, responding to verbal inquiries and complaints within 2 business days or less, and responding to written queries or complaints within 10 business days or less. Understanding the billing process. Billing is the process of collecting and presenting to the payer all agreed upon data elements that are necessary to secure payment for services rendered. Includes initial billing, follow-up, cash posting, and management of accounts receivable. Billing procedure barriers. Billing and collection personnel often cite inadequate and incorrect information received from the admitting and patient access department as the single greatest reason for an inability to bill and collect accounts receivable in a timely manner. Gathering of the patient demographic and insurance information. Patient access services staff is challenged to obtain this tremendously detailed information accurately while exhibiting care and compassion that is symbolic of our HRO Model Hospital Center. Front-end data requirements for billing. Here are some examples of demographic and insurance information typically collected by patient access services staff for the billing process. Name and other identifiers such as sex, date of birth, race, social security number, and marital status. Address, home telephone number, occupation, and employer. The type of room accommodation requested or required, inpatient, observation, hospital ambulatory surgery. Contact information, next of kin and emergency contacts. Contact information for the person responsible, the guarantor of the bill. Front-end data collection requirements for billing continue. Name, address, and group number, certificate numbers for third-party payers, a listing of benefits the patient is entitled to, the name of the primary care physician or PCP, authorization of pre-certification, the name of the admitting physician, the name of the attending physician, admission diagnosis given by the admitting physician, date of most recent or previous admission or outpatient services for the patient, accident information or occurrence, financial resources and disclosure of guarantor. Front-end data requirements for billing continued. Key information should be verified by the means of patient identity verification such as government-issued ID or passport or driver's license, biometrics, palm scanners to help identify the right patient record, patient ID software which validates address validation and even phone number checks. Medical insurance cards are one of the most important pieces of information that a registrar can obtain at the time of a registration or at the time of scheduling. Demographic and insurance information obtained during the previous visit should be reviewed and re-verified during each admission and registration, or even scheduling. Many organizations use claim editing systems or claim scrubbers to identify missing or incorrect encounter data. Claim editing systems allow an organization to bill only clean claims. So the software is there to basically scrub the 837 file, correct the errors before sending those claims to the payers. When patient access staff successfully obtain and verify all critical encounter data, a clean claim can be generated by the patient accounting department. When this happens, patient billing can happen without intervention from the patient accounting staff. More clean claims, less time spent, more revenue. When critical encounter data is not obtained by patient access staff, patient accounting staff may be required to intervene by collecting this information in order to successfully process a claim. This approach is time-consuming, expensive, and frustrating for the patient accounting staff. What is claim adjudication? Determination of benefit levels and coverage, coordination of benefits, or COB for short, subaggregation of third-party liability, or TPL claims, generation of appropriate explanation of benefit, EOB forms. Claims adjudication. Encounter data are information, financial and clinical, about healthcare services provided to managed care organization enrollees. Patient access services must capture as much of the encounter data needed to successfully bill a patient. Encounter data is generally submitted to the form of a pseudo or zero payment claim, a UB04, also the CMS 1450, or physician outpatient practices, which is a HCFA 1500, CMS's 1500, and helps the payer analyze population's utilization of healthcare services and the cost of those services. The UB04 claim is an electronic format of the CMS 1450 paper claim form that is used in general until 2004, when the 837 transaction became the requirement for electronic billing. The UB04, or Uniform Bill 04, was mandated by HCFA and the Healthcare Finance Administration, now CMS, for the use by institutional, hospitals, skilled nursing facilities, home health agencies, and community mental health facilities. The 1500 claim. The CMS 1500 form is the standard claim form used by a non-institutional, non-hospital facility, providers, or suppliers to bill Medicare carriers and durable medical equipment, regional carriers, DME RCs, when a provider qualifies for a waiver from the administrative Simplification Compliance Act, ASCA, requirements for electronic submission of claims. The 837 claim. The 837 healthcare claim or encounter transaction. This transaction can be used for institutional, professional, dental, or drug claims. This format has been required for the electronic billing of claims since 2004, when the administrative simplification provisions of HIPAA became law. Ultimately, patient accounting claim adjudication efficiency cannot occur without patient access excellence and the attention to detail. Caring service on the front end has only occurred if the information necessary to bill and collect a patient's account is completed in a friendly, courteous, timely, and accurate manner. Patient access best practices. Pre-encounter financial authorization, pre-certification, pre-admission, and payer verification. The best time for gathering the encounter information needed for billing is prior to the patient's arrival at the point of service. A successful pre-admission and pre-registration program secures the specific information that must be gathered, which includes demographic data, insurance data, and financial information. Other tasks performed during the pre-admission and pre-registration process are obtaining or verifying insurance benefits, determining whether pre-certification or authorization is required, checking for existing accounts and bad debt, estimating patient charges and patient liability, establishing a mutual understanding with the responsible party relative to the financial processing of the account, beginning clinical screening by obtaining key demographic data for medical record, as well as information about prior medical history, travel screenings. Upfront collections. The provider should let the patient know if there is a deductible, co-payment, or a self-pay balance amount required and the expectations as far as payment for service. This upfront communication with the patient extends caring by helping to alleviate possible future misunderstandings when bills are received, and it also helps expedite payments to the provider and the hospital. Requirements for billing. Typically, the following signatures are required to complete a patient encounter: general consent for admissions or medical treatment, authorization to release information to the payer, assignment of benefits by the patient to the provider, and financial responsibility agreement. Advanced beneficiary notices, ABNs, a notice that the doctor or supplier should give a Medicare beneficiary when furnishing an item or service for which Medicare is expected to deny payment. Transaction sets and standards. Provides a standard transmission for data. Electronic transactions have a routine format, eligibility and benefits, remittance advice, claims information. Providers provide a standard transaction. Health plans provide a standard transaction. The current standard versions utilized by providers in an effort to remain compliant are the ASC X12, MSPQ, Medicare Secondary Payer Questionnaire, are for Medicare patients only. They are to determine if another payer besides Medicare is primary, such as an employer group health plan, third-party liability, motor vehicle accident, or workers' compensation. Are not required if the provider or facility can access the MSP information via the Common Working File, CWF, or send and receive an X12, a 270 or 271 transaction, an inquiry, and a response. Here are your answers to the pre-module questions for self-assessment. You successfully completed this course. I want to say hello to Ken and Jason, the guys in purple shirts at Rivet. I hope you enjoyed this particular session, and I'll see you on the next video.